Good morning, viewers. Once again, I'm called Bihira Mediatrix Byaruhanga. I work with Uganda Catholic Medical Bureau. I'm going to talk about tuberculosis this morning. The celebrations for Uganda this year, 2025, are going to take place in Nakasongola. So we thought it was necessary for our viewers to really get to know about tuberculosis. Maybe one may wonder why we are talking about tuberculosis, especially in Uganda. I know it's a problem world over, but we can't sit back and keep quiet, and more so especially when it is being commemorated every year. Around 90,000 Ugandans get infected by tuberculosis every year, and of those, 30,000 die. So we cannot sit back and keep quiet. So we are commemorating this noble cause, and we are also reminding people in our country that TB is a serious disease. It kills, and yet it can be cured and it can be prevented. Maybe one may wonder and say, what is TB? TB is tuberculosis, which is a disease spread by a bacteria. This time around, it's not a virus. It's a bacteria called mycobacteria, which infects most times the lungs of someone, and once it has infested the lungs, then you get the disease that is called TB. We've got two types of TB. We've got latent TB, that is a TB that is not active and yet one has it, and we also have active TB. So when this bacteria attacks a human being, most times they intend to go to the lungs. But we have also what we call extrapulmonary TB, a TB that actually does not go to the lungs but can go to any other part or any other organ of the body. You've heard people saying someone has got TB of the spine, TB of the brain, TB of the kidney, so those are the extrapulmonary TB. But the other common one is the one that attacks the lungs, which we call pulmonary TB. It affects the lungs. So once this bacteria has infested, you get the TB, and it is highly infectious. It is an airborne disease. What do I mean when I say TB is an airborne disease? It's not something that you are going to drink in water. It moves in air, and that's why it is highly contagious. And that's no wonder we have those numbers that get infected per year in Uganda, and we lose them. So when TB has affected someone, how do you know that you have got TB? What are those signs and symptoms? How can one tell that they have got TB? If it has gone to the lungs, there is definitely coughing. And gone are the days where we say that you cough for 2 weeks or cough more. These days, every cough, we must investigate you for TB to make sure that it does not go beyond. So if you are coughing, please go and seek medical attention. So once you go to a health worker, they are going to find out. If you are coughing and there is a sputum, they are going to test the sputum to be very sure that there are no bacteria that cause TB. So one of the signs and symptoms is a cough. There is sweating at night, and sweating a lot. I know it's been hot and somebody might say, but I have been sweating. If you are sweating, you get what we call, you get drenched, you get soaked in sweat. So that is a very bad sign of TB. There is losing weight. Just you get out of nowhere and you start losing weight. You get tired, you cough, and you are feeling pain in the chest. All of those are signs and symptoms of TB. You get fever, the fever that is on and off. It's because most times whenever people get fever, they think they have malaria, but the fever for TB is funny. So you need, when you are getting these signs and symptoms, for God's sake, seek medical attention. Then there are those, when the signs have become worse, you start coughing blood. You cough, whatever you are coughing out is stained with blood. You start getting chest pain, you fail to breathe. All of those are bad signs and symptoms of TB. So maybe one may wonder and say, you also talked about the TB that is not in the lungs. How would you know that you have that kind of TB? If it is in the stomach, if it is somewhere, most times you present with diarrhea, you present with those unusual things. Even if fever will set in, the only thing that if it is not in the lungs, maybe you might not cough. But if you are not feeling well, if you are not feeling uneasy, please go for medical checkup, and they make sure that you do not have TB. So those are signs and symptoms of TB. What causes TB? Other than the bacteria I've talked about, what are those risk factors that put someone that make you prone to get TB? One of them is malnutrition. If you are not eating adequately, if you are not eating very well, chances are that you are likely to develop TB. The other one is excessive smoking. If you are smoking, you are putting your lungs at risk, so you are likely also to get TB. Then if you are in crowded places, I said TB is an airborne disease. So if you are in crowded places, you don't know the next person that is seated to you. You don't know the next person that is standing next to you. When I talk of crowded places, I mean, for instance, in Kampala, if you go downtown, you see how the city down there is crowded. If you are in taxis and the windows are closed, you don't know the next person that is seated with you could be harboring TB. So avoid such places. And if you are tell them to open the windows. If you are in a taxi, ask the conductor to open the window so that at least there is fresh air. Then, of course, if you are in a congested place, maybe in parties, make sure you distance yourself. Remember the days when COVID-19 was on, how we are telling people to observe distance. You can also observe it because you don't know the next person that is next to you. If you have this person that is coughing, whether it is in your office, whether it is in your neighborhood, encourage them to go and seek medical attention to make sure that they are not sitting with the TB. Because once they have TB and they are not on treatment, they are going to infect you. In schools where we've got our children, especially in boarding schools, most times when the children get sick, the school administration tend to keep quiet. For God's sake, if you have the child and is coughing and you don't have a school nurse, call the parents to come back and get their children and take them for medical checkup, just to be sure that we are not keeping TB at schools. So how can we prevent TB? Now, TB is preventable. I've said that if you have children, because actually what we do in Uganda, we have immunization. So there is what we call BCG. Every child born in a hospital or in a health facility is immunized. But I'm not saying that those born at home should not be brought to the health centers to be immunized. So that is prevention number one, immunization. So when children are immunized, we minimize chances of them getting TB. As I've said, sometimes it can be at school and you don't know. But once they're immunized, the chances are limited. Then also, the other thing I didn't talk about is that TB normally goes with people with what we call immunosuppression. People have got underlying problems, the diseases like HIV, diabetes, but mostly HIV. Because actually you find most times people living with HIV, if they are not put on treatment early, they develop TB. So by the time they come for testing, because of course when today in Uganda, when you go to a health facility, it's a routine testing for HIV and they also screening for TB. And most times you find those that have delayed to come for testing, they actually come in when TB has set in. So if you come and you have got HIV, they first put you on treatment for TB for the first 2 weeks, and they also put on ARVs, on drugs for HIV. But if you have TB alone minus HIV, treatment is only for 6 months. You get treated, and 6 months you are okay. If you are taking your drugs if you are adhering to your medication, because to really see that we are making sure as a country to eliminate TB in our country, to make sure that those numbers that I mentioned earlier are catered for. Whenever we put you on TB treatment, we don't stop there. We put you on TB treatment and we do what we call contact tracing. If you have come as an individual, we want to find out, what about the people that are staying in the home? How are you living? Are you congested in one room? Because I said this is an airborne disease. So we also screen them. And actually we even put them on what we call prophylaxis, a prevention. We've got tablets we put you on to make sure, because you are next to this person that has got TB, which is active. So also make sure that we prevent you from contracting this TB. Then of course the HIV people, the HIV positive people, it's a must. Every HIV person, as much as you have started treatment, we also put you on preventive therapy for 6 months to make sure that you don't get TB, because actually TB finds it very, very easy to penetrate to people who are living with HIV. So for now, that's what I can say. make sure that if you have this person that is coughing, even if it means reporting, you help us. Because we've got community health workers who come to screen, but most times you hide from them. Then when this person is taken to the hospital and is being diagnosed that he has got TB, then you start saying, this one we are going to chase away, without knowing that actually that person you are chasing away, once we have discovered they have TB and we put them on treatment, for you who is saying we are going away, we have not screened you, you could also be having TB. And so we encourage you to support them when they are taking their treatment. Don't stigmatize them. Don't look at them as they are a curse in the family. No, help them, support them to complete their TB treatment. Thank you so much.